24. Now, throughout Breast Cancer Awareness Month, we've been sharing the stories of the women up Here for the Girls. You know, Ashley Smith has been showing those every Thursday. And joining me now this afternoon are Chris Schwab and Renee Bowditch from the organization. Good afternoon, you all. You know, talk to me about what is Here for the Girls, really.
Hi, Bethany. How are you today? Thank you for having us. We're just so thrilled to be here. So Here for the Girls is a nonprofit, and we support young women who are diagnosed with breast cancer. What's exciting for us, you know, especially for the month of October, is that we put out an annual publication. It's a health guide. It's called A Guide to Caring for Yourself, and it's in conjunction with our calendar.
Awesome.
And our calendar features these 12 amazing ladies and their own personal stories and their personal journeys, much like the ones that Ashley is interviewing. But with the In the Know, the event that's coming up on Thursday, it brings the information that's in the guide to life. So it's exciting, it's comprehensive, this information, and we're happy to share it with the community.
And this event that's happening on Thursday, In the Know, it's really just to let people become more aware of kind of how to get tested, to be aware early before anything. Talk to me about this event.
So what we have is we actually have featured, there are 4 of our health partners. So Riverside Health System, VCU Massey Cancer Center, Virginia Oncology Associates, and Myriad. They partner with us to produce the guide, and they're all going to be on a panel. And they have 4 different topics, and each physician and expert is going to get a chance to just educate the community.
That is so amazing. And when is this happening again? Remind me of the dates and the times people need to be aware of.
It's Thursday, October 20th at 6:30. It is Facebook Live, and we have the information on our homepage, on our website.
And so talk to me about how someone, if they go in, they start this virtually, what are they going to expect at this event?
Renee, do you want to chat about that?
Sure. Well, you feel like you're there, and it will be a panel, and I don't know, are we having any questions? They can send in questions.
We do. We have a facilitator. She'll be facilitating, Melissa will be facilitating the actual panel and discussion, and people are invited to chat in the Facebook Live.
So the great thing is you get all this information, you can be at home in your pajamas.
Yeah, I love that part.
I do too.
And talk to me kind of about what the goal is with, you know, In the Know and Here for the Girls, and kind of just as a whole what the idea and the goal is for this push.
Well, it's to educate the community, but what I'm going to do is turn it over to Renee and chat a little bit about what this looks like from a breast cancer survivor and the fact that we're bringing in people from different health systems.
So when you're diagnosed with breast cancer, we serve young women in their 20s, 30s, and 40s. And the thing that it hits you, it scares you to death when you're told that. And one of the things that this In the Know is going to help is encourage self-advocacy, advocating for yourself. We know our own bodies. You know your own body better than anybody.
Right.
And too many of our young women went to their doctors with a concern and were told, oh, don't worry about that, you're too young to have breast cancer, or breast cancer doesn't hurt. Well, the ones who knew to advocate for themselves got further testing. The ones who just said, okay, often their diagnoses were delayed to their detriment. So this event will encourage advocating for yourself for women of all ages. It doesn't have to be just young women. And the other thing about having all these wonderful health systems come together, I mean, some of them might be called competitors even. It's a level of trust. When you are diagnosed, you want to know you can trust your medical professionals. And the thing about the medical professionals and the health systems we work with is that they care about you as a person. They care about their patients, but they also care about other health systems' patients.
Absolutely, yeah.
And so that collaboration coming together should just improve trust. And we are so grateful for how our health systems work together to help us get the word out to all women and the men who love them. And men can get breast cancer, so even there, they work hard to educate so that people can take charge of their own health.
That was a big statement there. If you are interested in going now, I don't know what else to tell you at this point. Chris, Renee, thank you so much for joining us again. This is October 20th at 6:30. You can find more information on our website. We'll be right back.